Hello, welcome. So excited to have you all joining us today. Welcome to our Advancing Health Equity in Out of School Time Virtual Institute. We have been working hard and just so excited to finally launch this training series and connect with you all today. So thank you for taking the time and choosing to spend your time with us today for this institute. We have a critical mass of people joining Zoom, so we are going to give people a couple of minutes to log on, close down whatever you're working on, take a moment, take a beat, and come join us for this institute. I'm Kate Goddard. I am the project director for the Collaborative for Advancing Health Equity in Out of School Time, and I work with the Education Development Center, and our team, along with our partners, the National After School Association, are thrilled to host this event. And I'm just going to do a couple of housekeeping things before we get started. Again, just knowing that people are always moving from meetings to meetings, joining Zooms to Zoom calls. So we're going to give people a couple minutes to really take the time to get in here today. So again, I'm Kate Goddard. I'm the project director for the Collaborative for Advancing Health Equity in Out of School Time. Today's Advancing Health Equity and Out of School Time Virtual Institute is part one of a series of trainings designed to really support you with advancing health equity in your out of school time programs. So as you're joining, just know that we are recording the event. We have all attendees on mute, but there will be opportunities for peer breakout group discussion. So later in today's training, you'll have an opportunity to connect with your peers. We encourage you to use the chat box throughout today's event. If you're having any technical issues, we have two tech hosts here to support you. We want to hear your questions. We want to hear your experiences. So please do use that chat box. And as I'm talking about the chat box, take a moment right now and you want to introduce yourself. You can share where you're calling in from or joining this web event from, and what organization you work with. In addition to that, we will be sending out the PowerPoint slides, the resources that are shared, the recording, all of that to all registered attendees. So if you registered for this event, you will get that information. So if you have to log off early, you'll make sure you know that we'll be getting all of the materials for you there. And then I want to call out a couple of things. We do have a live transcription happening. So in Zoom, you can click on that. You should see like a pop-up telling you that that's available. So if you want to look at that, feel free to do that as well. And I think that's all of my housekeeping notes. Again, I'm just so excited to have you all here. I think we're all accustomed to Zoom environments now, but just a reminder, you're all muted, but you will have an opportunity later on to unmute, turn your videos on, and participate in breakout discussions. And this is being recorded, and you will get a copy of that. So I'm going to take time right now to officially turn this over to a colleague of ours at the National After School Association, Angelica Portillo. She is going to be officially welcoming us and kicking off today's Institute event. So Angelica, turn it to you.
All right, thank you. All right, so hello and welcome to the Advancing Health Equity and Out of School Time Virtual Institute. My name is Angelica Portillo. I am the Director of Advocacy and Workforce Initiatives for the National After School Association. Thank you for joining us along with the Education Development Center team for this virtual event. Most of you participating today understand that before school, after school, and summer enrichment programs are a valuable part of the ecosystem, along with schools and other services that support young people, families, and communities. You know that out of school time programs, when staffed with skilled and knowledgeable professionals, create a multitude of positive experiences and outcomes for youth. With funding from the Centers for Disease Control and Prevention, we are excited to launch this new project, the Collaborative for Advancing Health and Equity in Out of School Time, in partnership with EDC. Our work is focused on improving the health and well-being of youth and staff in out of school time programs, with a particular focus on groups that have been marginalized and that are even impacted or most impacted by health disparities. Please note the intentional mention of staff. As we work to increase health and well-being for youth, we're also supporting job quality for professionals who do the most important work. Job quality impacts things like worker recruitment and retention, staff well-being, professional development, and ultimately the overall program quality. Out-of-school time professionals create the experiences and relationships that benefit young people. Low-quality jobs in our profession impact workforce stability and destabilize families and communities. If we don't make changes as we try to support populations out of poverty to better health and better quality of life, then we are perpetuating some of the inequitable systems that cause these problems in the first place. If we can't attract people to the profession and keep them, we will not be able to provide the services that kids, families, and communities need, much less at the levels of quality that are most impactful. And ultimately, positive impact is why we're all here. Now, I'm going to turn it back over to Kate, who will tell you more about what to expect from the Virtual Institute and our time together today. Thank you.
Thank you. Thanks so much, Angelica. And I want to also thank Heidi Ham with the National After School Association. She has been, we've been closely working together to put together this institute. And so thank you both for your support and all of the energy and wisdom you bring to this work. So Anna, next slide, please. So just Angelica has already spoken to this, but again, we are a new initiative funded from the CDC called the Collaborative for Advancing Health Equity and Out of School Time. I'm Kate Goddard. I'm the project director for this project. Again, working closely with the National After School Association and our organization, Education Development Center. But I just wanted to give a special shout out to our incredible program officer and the support from the Jorstad Blackwell and the CDC team. They have been so supportive and incredible partners with us as we have launched this project. And this is our first event. So this is our first training event, but there will be more to come. So we couldn't do this work without them. And so I just wanted to say thank you for that. Next slide, please. And so as I mentioned at the top of the hour, this is really an institute designed as a training series to provide opportunities for you all to connect over the next 2 months to really think about how we can advance health equity in the out of school time field. And so because we'll be engaging in multiple sessions, we wanted to establish some kind of community agreements for how we want to participate together. And so I invite you to commit to these agreements, and you're already committing because you're bringing yourself and you're taking the time to join us today. But to really think about this as a learning opportunity for you and an opportunity for you to share and to connect. And so I ask that you bring your whole self, that you actively engage and stay engaged, to fully participate, ask questions. Like I said, use that chat box, ask questions, and really, really, I want to emphasize, share your experience. We know you bring so much expertise to this topic, to this work. And so we really want to hear from you. And as I've said before, we will have time for breakout discussions and lots of opportunities for sharing. And we have some incredible presenters lined up to talk about their work. And we'll have time to talk with them about their work. So really do want to invite you to bring your experience, bring your expertise, and ask those questions. And I wanted to note also that because this is an ongoing training series, we're going to have 2 additional workshops, technical assistance workshops to support you all with implementing some of these policies, practices, and activities. And then another training session in January. If you have ideas or offerings of things we can add to these community agreements, please include those in the chat box or reach out to us. We'll be using these throughout our time together. Next slide, Anna, thank you. Okay, so what is on deck for today? Here is our very full agenda, and I'm going to be quick, but we are going to take some time to do some introductions and hear from you all. And then we are going to talk a little bit around the role out of school time can play in really advancing health equity. Following that, we are going to hear from some incredible presenters from Georgia, Lindsey Jorstad and Wendy Palmer. They're partnering together in Gwinnett County. And then we'll be hearing from Ashley Edmondson and Aimee Moody, who are working together in Maine through a Let's Go initiative. After their presentations, we're going to have time for peer breakouts, and then we're going to have some time for full group debrief, some closing, and then we're going to want to get some of your feedback on how today's training series went and what you're looking forward to in the future. So we'll have time for a quick survey at the end as well. So next slide, Anna. Thank you. So as I keep mentioning, this is an institute, and the idea and design is to build this work out over the course of the next 2 months. And so the goals of our institute are really to increase the understanding and application of practices and policies and tools that support health equity in out of school time. Another goal of ours is to promote youth health and well-being through the use of the healthy eating and physical activity standards for out of school time. And let me say, when I mention out of school time, I'm really talking about programs that work before school, after school, summer programs. These are programs that work in schools, in communities, in parks and recreation centers. We're really talking about the full gamut of out of school time here in the Institute. And then also I want to mention the healthy eating and physical activity standards. We will refer to them often as HEPA. And I want to also acknowledge that the National After School Association, our partner, is the publisher of those. And so you'll see that referenced as well. So we'll talk a lot about those today. And then additionally, we have our goal is to provide resources for capacity building and some assessment tools to support you in increasing the adoption of the HEPA standards. And then we really want to promote a process of continuous quality improvement so you can really advance your goals. Next slide, please. So that's the goals of the Institute. What are we hoping to do today? Today, we're really going to focus on these following things. We want to define health equity. We want to talk about how health equity can be centered in out of school time. As I've already mentioned, we want to share and talk about the National After School Association Healthy Eating and Physical Activity Standards and the assessment tool. These are resources that are available to you, and we'll look at those in a little bit here. Share barriers and successes to implementing health equity strategies in out of school time. Again, in addition to our presenters, we're going to have time for breakout groups to dive into that and explore that. And then identify additional resources related to health equity in out of school time. Next slide, please. Okay, but first we want to hear who's on today's training. And so we want to take a moment and pause and do some introductions. And this is a activity. This is a tool we're going to use to facilitate introductions among all of us. So Liz has just posted a link in the chat box, or you can pull out a smartphone and use the QR code to get to that link. And I ask for you to take a couple minutes and to reflect on, what brought you here, why are you here, and what around the issues of health equity for the young people in your communities. And so take a moment and respond to the question, what issues are youth experiencing in your community that impacts their health and well-being? So we're just going to take a couple of minutes. You can, again, visit the link that's in the chat box or use your smartphone to use the QR code to get to that link, and take a minute and reflect on that question, and then we'll share the results in just a minute here. And I'm going to see if anyone's having questions, comments on accessing it. Great. I'm seeing some good responses already. So I will share those in just a minute here. So take a minute. Think about what you're seeing with the young people that you work with in the community that you are in, and what are some of the impacts that they're feeling around related to their health and well-being. And I'm going to go ahead and start sharing my screen because we got some good responses coming in. Okay, and please do continue to go here and add your ideas to the screen. And I'm going to scroll through, but again, is really thinking about the young people that we all are working with and interacting with in our communities. What are some of the issues that you see that are impacting them? So I'm going to kind of call out a few just so as others are kind of adding in some ideas and scanning our responses. But mental health, depression, poverty, racism, body image, seeing stress and emotional well-being. There's a comment here about the transition from virtual school to in-person. Heard that as well, that it's not going well. Poverty, we're seeing again, behavioral health, overtaxed teachers. Think back to Angelica's opening remarks and thinking about the staff and those who are working with young people. We know that lack of affordable OST programs and transportation is a persistent issue. Access to mental health issues, bullying. We have homelessness. Definitely seeing a trend of mental health, which we all know young people are experiencing a mental health crisis right now. Whew, this is a heavy list. Access to food, military deployments and separation, trauma. So some people are reflecting around what kids are eating, seeing more violence. Political attacks on trans students and athletes. Stressed parents. Yes, that's a good one. So lots and lots of issues I think we're all experiencing, that young people are experiencing. So thank you for contributing these things. This is a really pivotal time in our nation and for the young people. And I think what we have an opportunity here to do in the out of school time space is really help have an impact and make an impact on these young people. So I'm going to turn it over to Rebecca Bishop, my colleague at the Education Development Center, to talk a little bit more about health equity and the role that health equity can play to make an impact on these young people's lives. So Rebecca.
Thanks, Kate. It's really good to be here with everyone. That was a great transition. Kate, you know, it really feels like, according to the list, many of you guys are experiencing some of the same issues, right? But it seems like, right, the issues are widespread. Thank you. You know, the issues are widespread. You know, before we can think about, you know, health equity with youth, we all know that it's important to meet young people where they are, right? When we think about not just Massachusetts, but nationally, you know, the Surgeon General of this country talked about the mental health challenges that children, adolescents, and young people are having. He actually called the rates alarming. He talked about, just like many of you said, that young people are struggling with feelings of helplessness, depression, thoughts of suicide, right? We also know, COVID-19, you know, is still in our world, right? But significantly, we know it's impacted our youth. Part of the Surgeon General's, the reason he was talking about this was because he talked about a mental health crisis among young people. 1 in 10 kids experience food insecurity, right? We saw that on the list as well. And the number of young people experiencing food insecurity, we know, has increased during the pandemic. A number of studies have documented that. And finally, we know that many young people that we serve come from poor neighborhoods, right? That generally have more crime, more pollution, fast food outlets, right? And ads promoting tobacco and alcohol use, right? So, number one, it's important to acknowledge this, right? And not just meet young people where they are, but really think about, if we're gonna solve these issues, right? These complex issues, it's gonna require complex solutions. And to Kate's point, I think that's where health equity comes in. Something else that was on the list, racism, right? We know that race is a threat to public health, and understanding the connections between racism and public health to systems of oppression and how they impact youth are also really important part of this picture of what are youth actually experiencing. finally, the other thing to kind of highlight when we think about what youth are experiencing, and many of you also talked about this, were priority groups, right? We know there are groups of young people who experience these issues more than others, right? And so we know that if we're going to talk about health equity, if we're going to talk about making a difference, if we're going to talk about solving these complex issues, it's going to be important to think about who's at highest risk, right? Who is showing up, who's at highest need, right? And to have some assessment to look at those priority groups. As Kate said, while this topic of health equity can be challenging for lots of reasons, we have an opportunity, and we have an opportunity to not just be intentional about health equity, but we have an opportunity to change practices and policies that can impact all youth that we serve. Next slide. Perfect. So we thought it was important to start with a definition of health equity, right? If you've ever addressed this, or any concept, if you think about it, whenever we introduce a new concept, we want to get on the same page about what it means. Because if you're familiar with this, you know that you could say health equity in one space with someone, and you could be saying the same words but meaning something different. This is the CDC definition, and it really highlights that health equity is about being fair and providing opportunities to be healthy, right? Part of what this definition acknowledges is that there are some young people, particularly the young people I just talked about, that are at highest risk. Those are the young people that fall through the cracks, right? Despite our well-intentioned programming, despite our well-intentioned funding, we know there are young people who are not being served, right? And so I think this definition really pushes us to think about not just to kind of check a box when we're talking about health equity, but to think about, right, societal efforts to address historical and contemporary injustices, overcoming lots of obstacles to health, right, both economic and social. And then, right, the big goal of this is to eliminate preventable health disparities, which is another way of saying eliminate preventable health differences between groups, right? So when we think about health equity, this is the goal. You may, I encourage everyone to look up their own definition of health equity and try to come to some agreement on your definition, because it's often the first step to addressing health equity. Perfect, I'm just looking in the chat. Thank you, Heidi. Next slide. We are gonna take a look at a video that's gonna go more in depth about health equity.
These days, we hear a lot of people using the word equity, but what does it really mean? It's not quite the same as equality, which means everybody gets treated the same. Equity is about fairness. It means that everybody gets what they need based on their own situation, because we're not all the same. The difference between equality and equity is important. It's part of the reason the United States spends more on healthcare per person than any other advanced nation and has much poorer health. It's important to remember that a person's health depends on many factors, things like their environment, schools, and workplaces, to name a few. We call these social determinants of health, like clean drinking water for children and easy access to fresh food. We can follow the lead of communities like Columbia Gorge in Washington and Oregon, where businesses, doctors, and farmers tackled the local hunger problem with the Veggie RX voucher program. And the New Jersey Partnership for Healthy Kids is bringing down high rates of obesity in underserved communities. We should be inspired by these local efforts and remember that health equity is all about making things better for all of us. When everyone's healthy, everyone benefits. These days.
So, this you can go back to the video, just the slide. Yep, try to pause it. So I just want to highlight a couple things on this video. So one is equity is not the same thing as equality. And that's intentional, right? Equity really is about helping people in the way that they need to be helped. And it acknowledges that you cannot use the same solution to help everyone if we all have different needs, right? So it really highlights tailored approaches to serving populations. The other thing I wanted to highlight is social determinants of health. When you think about health equity, the goal really is to increase opportunities to reach social determinants of health, right? And this is really the connection to this work. Healthy eating and physical activity is a social determinant of health. And I believe we're going to hear more about that. I'm going to go ahead and pass it back to Kate.
Thanks, Rebecca. Thank you so much. Anna, if you want to go to the next slide.
Days.
Great, thank you. And I know there's a lot here to unpack. And I think one of the opportunities we have, again, with this institute is to open up these conversations, and we have time and space over the next couple of training sessions to really unpack the health equity, and then also think about the role out of school time plays in really helping to advance it. And so I just want to take a minute and just acknowledge and recognize that, out of school time programs have a long history of ensuring that all youth have access to healthy foods and opportunities for physical activity, that they have a place where they feel safe and are engaged in culturally relevant learning activities that are purposeful and intentional, and that they form positive relationships with adults and their peers. And I want to emphasize the importance of positive relationships, because young people, like all people, need to experience positive relationships. And when they feel alienated, young people are more likely to seek unhealthy or unsafe relationships in their search for connection. And we know that our school time programs really do a great job of fostering those safe environments where those positive relationships can form. We also know that research tells us that regular participation in quality out of school time programs have been shown to improve students' self-confidence and self-awareness and positive social behaviors, as well as decrease problem behaviors. Additionally, research shows that programs that provide healthy foods and keeps kids active is associated with decreasing anxiety and emotional distress and increasing self-esteem. So again, we know that all of us who are doing this work know the positive outcomes and benefits of intentional, purposeful programming can have on the young people we serve to really help them, support them through the issues that they may be experiencing in their lives. One thing I want to emphasize here, though, is when we talk about the research and what it says is that quality is an important word to really underscore in thinking about the program and the opportunities young people are experiencing in the out of school time space. And so as we kind of progress through today's session, we're going to really open up and start talking about the healthy eating and physical activity standards, those HEPA standards for OST, because they provide a research-based framework for programs to understand and measure their program's healthy eating and physical activity. And then they can be used to help inform a plan for improvement to really support high quality programming that promotes healthy behaviors. So we're going to be hearing from presenters. They're going to talk about the work they've done with implementing standards in their programs and how this has really helped move the program quality into really promoting healthy behaviors and promoting health and wellness for the young people in the programs. And I just want to say that knowing that we can make a positive impact on the health and well-being of youth, out of school time programs can really build upon our foundation for positive youth development and become strong partners in the system that supports a whole child's health and wellness. So next slide, please. Thank you. And so I wanted to acknowledge that the CDC has a framework, a model called the whole school, whole community, whole child. And it's really their framework for addressing health in schools. It's also called the WISC model, is a student-centered and emphasizes the role of community in supporting the school, the connections between health and academic achievement, and the importance of evidence-based policies and practices. And again, this is an opportunity for out of school time programs to see themselves as partners in the whole school, whole community, whole child model, as an opportunity to engage with schools as partners to advance this work. And many schools are implementing this framework. Actually, the CDC has a Healthy Schools initiative that funds school districts and local school districts to implement this framework, and out-of-school time partners are a critical partner in the kind of full vision of this model. So I just wanted to highlight that and share this as an opportunity for you all to be thinking about how you can play a part in partnering with schools to address health equity for your community. So next slide, please. We're going to go into a quick poll. So we've been talking about and teasing the healthy eating and physical activity standards, and just want to take a moment here to see people's experience with the HEPA standards. Are these something that you have used in your program or in your work, or even, like use them to inform your work? Is it something that you have not used yet, or this is brand new to you? Maybe you're not sure. Maybe you haven't heard of the HEPA standards or seen them. So just take a minute to complete that poll. Great. All right. We have a mixed results here. So it seems, which is great, because if you have been using the HEPA standards and your familiarity, we want you to bring your experience and share. If this is new to you, ask questions. You'll be learning more about them. And then not sure, that's good. We'll make sure at the end of this, you know what they are. So go ahead and close the poll out. Anna, if you want to share the results quickly, we can. And we can move to the next slide, please. Great. So for those of you who this may be new, the healthy eating and physical activity standards are standards, as I said, that have been evidence-based to really support programs with adopting healthy eating and physical activity in their out-of-school time programs. The National After School Association adopted the standards to provide practical, comprehensive guidance for out-of-school time programs. So note that these standards are aspirational in nature. So they're not, all the standards are not applicable to all OST programs, and some programs you may hit roadblocks in implementing the standards. You may not have some resources, cooperation with external organizations. Maybe you have lack of control over certain programming features. So again, aspirational, they're really meant to be a guidepost towards which programs should, a guidepost towards where you can work and feel like you should tailor them to your specific needs and to your specific context for the program that you're doing. So you can see on the slide here, there's a lot of standards, again, aspirational, but really helpful in kind of guiding you and thinking about where you want to go with your program and what standards you want to focus on, and to put plans in place to achieve those. So the HEPA standards you can see here, there's kind of 5 areas of focus. So they address the food and beverage and physical activity content and quality. So that's the content and quality standards. There are standards around staff training, standards around social supports, standards for program supports, and environmental supports. You can move to the next slide. We're going to hear from our presenters more about the standards. So I'm going to be a little quick on introducing them, and Liz has posted them in the link to them in this chat box. So feel free to go browse them as well as we're kind of talking through them. And then just a quick note to know that these have been around for some time. So back in 2009, a coalition of individuals from the National Institute on Out of School Time, often referred to as NIOST, the University of Massachusetts, Boston, the YMCA of the US, collaborated as the Healthy Out of School Time Host Coalition to develop the standards in out of school time. So then in 2018, the Host Coalition leadership team added new members, the National Recreation and Park Association and the After School Alliance, and they completed an extensive refresh of the standards. So if you see HEPA Standards 2.0, that's just referring to that refresh. So we can go to the next slide, please. One of the important resources that a companion to the healthy eating and physical activity standards is an assessment tool. And this assessment tool aligns with the standards and provides you a resource to really look at the standards and assess what you're currently doing, reflect on what you're doing, and then make a plan for action. So let's just move to the next slide. So this is what the self-assessment tool looks like physically. And again, Liz is posting the links in the chat box. So you have an opportunity to kind of do this kind of assessment of giving yourself a rating, do some reflection, and then plan and create some actions. And so this institute is really going to be a guide in guiding you through this process. So introducing you to the standards, to the assessment tools, and then giving you some strategies and giving you some ideas for putting this into practice. So next slide. So let's hear about these strategies and actions. So we have a fantastic lineup of presenters. As I've already introduced, Lindsey, Jorstad, and Wendy Palmer. Lindsey works with the Gwinnett County government, and Wendy works with Children's Healthcare of Atlanta. They've been doing a partnership. They're going to be talking about that. And then immediately following their presentation, we'll have Ashley Edmondson from Let's Go Community Health and Aimee Moody with the Waterboro 21st Century Community Learning Center program present. They too are in a partnership. And then after both their presentations, we'll have time for questions and answers. So if you have questions, put them in the chat. We're monitoring that, and we'll make sure we get to those questions. So with that, Wendy, I'm going to turn it to you.
Thank you, Kate. Next slide, please. All right, well, thank you for having us today. I'm really excited to tell you a little bit about the work that is happening in Georgia between Children's Healthcare of Atlanta and our partners in Gwinnett County government. Next slide, please. So I just want to orient the audience because I come from a healthcare institute, and oftentimes when working with out of school time, just kind of giving them some insight as to how, as a healthcare partner, we can contribute to the health and well-being on the community level. And I think one of the things that I am so inspired by working at Children's and Healthcare of Atlanta is really just our mission. And this is our hospital mission, to make kids better today and healthier tomorrow. So of course, we as a hospital, we're the largest pediatric healthcare system in Georgia. We are taking care of sick kids, and that's our primary business. But really my team with Strong for Life is fortunate to be the healthier tomorrow piece of our hospital mission. So Strong for Life is the name of my team, whose mission is to really help families raise healthy, safe, resilient kids. And we do that through a variety of partnerships with community level influences on children. So thinking about this circle graphic that you see here on the side is really rooted in the socio-ecological model of health, with the child and the family at the center of the model, and then the layers of influence around that child. These are the environments and the spaces where kids live, learn, and play. I know we hear that quite often. So my team is comprised of doctors, therapists, dietitians, exercise physiologists, and folks who are in that space of public health and are doing this outreach outside of the walls of our hospital system to impact the health and well-being of all kids. We certainly do work with schools and early care centers, with our primary care healthcare audience across the state of Georgia, but then also have this tremendous opportunity to impact the well-being of children through our community partnerships in that out-of-school time space. Next slide, please. And one of the things that I talk about quite a bit is just the fact that as a nonprofit healthcare system, we are required by the IRS to maintain our nonprofit status to conduct a community health needs assessment every 3 years. So what you see on the slide here is probably not surprising, considering the Mentimeter that we did just a while ago, but these are the results of our 2022 community health needs assessment for Children's Healthcare of Atlanta. And this is a robust process where we really are gathering feedback from key stakeholders who impact children and impact the well-being of children and adolescents across the state of Georgia. So we're talking to the healthcare sector, we're talking to school leaders across the state, we're talking to out-of-school time leaders across the state, and gathering that feedback to help us determine what are these priority health needs that we need to dedicate our community prevention budget to help have an impact on. So as you can see, not surprising that behavioral health and mental health is definitely top of that list for community health needs. I don't think that is unique to Georgia in any way, shape, or form, followed closely by chronic diseases, which does include things like diabetes and obesity and asthma, adolescent health issues, which are many of the things that were mentioned on the Mentimeter as well, child obesity, injury prevention, infectious disease, community outreach, just primary care, medical homes, health literacy, and then oral health. So I think sometimes when I'm working with community partners, they're like, well, this is great, but how does this really connect back to our partnership and to our work with you? And I think one of the things I hope that many of you will get out of this today is to think about your local healthcare system and think about your local hospital and the fact that they need to identify these needs. And it's a tremendous opportunity for partnership on the community level. And out of school time partnerships are top priority in this space when we think about the volume of kids that have access to out of school time programs and the time spent there. And how can we collaborate in a way that we are implementing these HEPA standards that would help impact these top community health needs as well. Next slide, please. So with Strong for Life, we really have these 4 healthy habits that we promote across all of our sectors. So whether we're at the pediatrician's office or we're in a school or we're at our Park and Rec department with Lindsey, who will tell you a little bit about what this looks like in that setting, we have these consistent messages because we believe that healthy habits are for all kids. Healthy habits are not just for kids who are obese or kids who are struggling with their weight, but healthy habits are for all kids. And certainly the impetus behind development of some of these healthy habits, which I know Let's Go will show you their version of this as well, maybe started with the obesity epidemic over a decade ago, but has really morphed and evolved to including emotional wellness and well-being, talking about sleep and the importance of that. And how does this factor in and contribute to our kids' improved well-being overall, which includes their ability to learn when they show up at school each day, lowers their risk for disease in the future, and really gets us to that right side here, happier, healthier kids. But more importantly, these are children and adolescents that are more productive citizens and are able then to return back to the community and have an impact in the community in a positive way. So this has really been the impetus for some of our partnership and our work with Gwinnett County and the work that's happened with Live Healthy Gwinnett. Lindsey's going to tell you a little bit about how our partnership really started and has evolved over the years. But I just want to reiterate from that healthcare perspective, this is important to us to help encourage kids to be happy and healthy. It's important to all of us in our school time as well. So how do we bring those two pieces together for equitable impact among our kids? So I'll hand it off to Lindsey.
Perfect. Thanks, Wendy. Anna, if I can get the next slide. Great. Good afternoon, everyone. Happier, healthier kids connects into our vision of being the preferred community where everyone thrives. Roughly 40 miles northeast of Atlanta, Gwinnett County is home to over 950,000 residents and is known as one of the most diverse counties in the Southeast. Being healthy matters in Gwinnett, and in 2014, our county government helped establish Live Healthy Gwinnett out of its Parks and Recreation Division. According to our past community health assessment, Gwinnett's obesity rate places a quarter of the adult population at a higher risk for serious conditions, as Wendy mentioned, diabetes, heart disease, cancer, respiratory problems, and stroke. It is also known by the assessment that over 20% of our residents get no leisure time physical activity. We don't want our youth today to participate in those same unhealthy habits that they may be observing from their adult role models. So we must intervene with the wellness standards and positive relationships mentioned before. Live Healthy Gwinnett takes on that proactive wellness approach to address the preventable chronic illnesses. Through community education, people can significantly reduce their risk of developing those chronic diseases by making very simple lifestyle changes, eating healthy, increasing their physical activity, taking advantage of preventative screenings, and reducing stress. This is all done through year-round partnerships, providing free programs and events that focus on our 4 areas of wellness pictured on the screen. Next slide, please. So what do we use to educate our leadership to support health equity work in Gwinnett? Being founded in Parks and Recreation, we truly believe that parks are the common denominator in which all populations should have fair and just access to the quality experiences. The National Recreation and Park Association's pillars help guide our efforts, especially their wellness pillar. In Gwinnett, we aim to cultivate a safe, livable, and healthy community
by providing programs and services that address basic human needs, including housing, healthcare, and food security. And alongside community partners like Strong for Life, we make critical services accessible to those in need, while focusing on moving that needle more towards equitable service deliveries that ultimately improve the health of our community. Following today's session, I do challenge all of you on the call who may just now be becoming aware of the National After School Association and the HEPA standards to really review with your teams and leverage the assessment tools to determine first steps of implementation. In addition to NAA's resources, I do challenge you to connect with your local or state out-of-school time affiliates. Here in Gwinnett, we work with the Georgia Statewide After School Network and our local positive youth development experts from Gwinnett United and Drug Education, or what we lovingly refer to them as GUIDE. They've established the Georgia After School and Youth Development Standards, which build upon those national best practices heard today. Next slide, please. With that being said, Live Healthy Gwinnett would not be where it is today without our healthcare champions like Strong for Life. They helped us personally establish our health and wellness standards from the get-go. These are written commitments that we agree to follow to provide environments that promote healthy habits for adults and children where they live, work, and play. These commitments include offering a variety of planned physical activities for persons of all ages and all abilities, access to healthy food and beverage options, especially in our out-of-school time programs, in our vending contracts, in our concession stands, implementing partnerships that support the well-being of our users and of our staff, leveraging tobacco-free park systems, and more. These standards dive deeper into catering guidelines for user groups, concussion and head injury procedures, and expansion of our out-of-school time promises, like 60+ minutes of physical activity daily, nutrition education, limiting of screen time, an array of caregiver support, and mental health resources, especially for our amazing staff and team members. I know it was opened up today about the amazing professionals in this field, and they too must be supported along with our residents. Next slide. So how do we know if our health equity strategies are making a difference? What's pictured on the screen is our community health dashboard located at livehealthygwinnettdata.com. This is where we leverage our up-to-date demographics, our education, our environmental concerns, economic, health, social determinant, and equality data that highlights trends and challenges that we're seeing in our communities. In a county as diverse as we are, we found that certain out-of-school time strategies work better than others, primarily mobile services, bringing recreation to play deserts, nutrition education and hands-on gardening to food deserts, and early learning and literacy to book deserts. You get the idea. We've got a lot of gaps across our communities. And ultimately, we are trying to meet our residents where they are while still offering our flagship programs at our traditional out-of-school time sites. Next slide, please. Wendy, do you want to kick us off on some of the initiatives we've been able to accomplish together?
Yeah, absolutely. So I think I spoke more broadly about health and well-being, and then Lindsey gave you some really specific examples of how that's been embedded into the county standards and the county policies that are being followed at all of the things that occur through these Parks and Rec departments. So what you see on the screen here are just some examples. We love to take pictures when we're out in the community. Hope and Will are our mascots at Children's Healthcare of Atlanta. So we have a water safety partnership with Gwinnett County, as they have pools at many of their park locations during the summer months. You see some supplies there for a sugar demonstration kit. That's some of the nutrition education that our team has helped develop, package, and kit and hand off to the Parks and Rec professionals who are implementing summer camp programs and able to do these fun activities with kids to teach them about choosing lower sugar beverages and drinking more water. And then you also see lots of examples of signage as well. It's been a tremendous opportunity. We have the most amazing park system in the country. I tell folks this all the time here in Gwinnett County, and our families spend a tremendous amount of time there. So one of the things that we do invest in is signage and campaigns and messages so that they are front of mind for families as they are out playing, to drink more water. Or the sign that you see there, to take a breath, has a QR code, and we have some guided meditation and guided activities that families can do while they're at the park together as well. So those are some of the examples there of activities that we have done with Parks and Rec folks. Lindsey, did you want to add anything on this one?
Just to add some of the Camp Healthy Habit messaging, Strong for Life has connected with us on our caregiver newsletters, our bulletin board kits. If we can advance to the next slide. Yep. It shows some of the staff trainings that they've put together and curriculums built that our volunteer camp aides are trained on, our camp staff, our health and wellness public interns through Live Healthy Gwinnett. A lot of this language is embedded into our habits so that our staff are the best role models in any type of out of school time program for participants.
Yeah, absolutely. Those wellness warriors you see there, that was an incentive. You know, we wanted to recognize staff who were role modeling and championing the habits that we trained them on. So if you were caught drinking water in front of the students, or if you were caught eating fruits and vegetables or engaging in a fun way, you were given this Wellness Warrior award. So it was a way to motivate the staff as well to really take ownership of their responsibility as role models and leaders for these young adolescents and for these children as well. And we really enjoy having that opportunity to come to these groups and provide training on these core nutrition messages and physical activity messages, and helping them recognize the role they have to influence that while they have time with the kids as well. Next slide, please. I think as Lindsey and I were just kind of talking through, what do we hope folks take out of our presentation today? Really, from my perspective, from a healthcare system, was really to think about, are you partnering with them? Are you partnering with your local experts who are dedicated and committed to improving child well-being in your community and making use of those? I have a fabulous team, and they want nothing more to go out in the community and spread those messages and work with these partners. And then our reward is really seeing that in action with great collaborations like we have with Gwinnett County. So I encourage everyone to leverage your local healthcare system when you can.
Perfect. And my last point was to find your change makers, your local change makers. Partnerships play a major role, whether it's after school program, a summer meals distribution, caregiver support. We must have those built relationships. Here in Gwinnett County, we rely on some trusted leaders in many of our underserved communities to be our health champions and invite our teams in to collaborate. This has been very successful in taking our out of school time programming mobile into mobile home communities, apartment complexes, extended stay hotels, co-ops, faith-based partners, you name it. Definitely find your connection points.
Thank you, Lindsey and Wendy. Anna, you can move. You can actually stop sharing. We're gonna do a quick transition here. Such incredible examples and just incredible work. So thank you both for sharing. I invite people to ask questions for the presenters in the chat box if they have them. But we are going to turn it over now to Let's Go Maine. So Ashley, I will turn it to you, and we can see your slides good.
There, you probably want to see my face too, huh?
There you are. Great.
Hi, my name is Ashley Edmondson, and I'm a program manager at MaineHealth. We are a non-for-profit integrated health system here in the state, and I work for a program called Let's Go. In the next few minutes, I'm going to provide you a brief overview of the program and who we are and how we partner with communities. And then you're going to hear directly from one of our partnered out-of-school sites and about her successes and challenges in the work. Let's Go is a community engagement initiative. We're working to create environments where the healthy choice is the easy choice. Let's Go, we use evidence-based strategies to improve policies, practices, and environments that support healthy eating and physical activity. We're very grateful to all of our partnered Let's Go sites and their commitment to improve the health and well-being of the folks in their community. Let's Go uses a multi-setting model where we reach community members where they live, learn, work, and play. We partner with schools, school districts, school nutrition programs, early care and education programs, out-of-school programs, and healthcare practices. Each of these settings gains access to tools and resources to help them promote healthy messaging and encourage healthy choices. Our main message is 5210, 5 or more fruits or vegetables every day, 2 hours or less of screen time, 1 hour of physical activity, and 0 sugary drinks, drink more water. This message is promoted across the state from our program through marketing, media campaign work, and also through all of our partnered sites. To help influence environmental and behavior change, we focus on 5 strategies, which are actions that sites can take in order to create environments, healthy environments. So each of our strategies align with our messages. The first strategy is to limit unhealthy food and provide healthy choices. Second strategy is to prohibit the use of food as a reward, which both, as you can see, align with our 5 message. Our third strategy is to limit recreational screen time, which of course aligns with our second message of 2 hours or less. Provide opportunities for physical activity, aligning with our 1 message. And last but not least, limit or eliminate sugary drinks, provide water, which aligns with our final message around 0 sugary drinks. So we really encourage our sites to adopt these strategies into practice in order to create environments where the healthy choice is the easy choice. And our program provides educational materials and trainings, technical assistance for sites to learn and explore while these strategies matter, the evidence to support them, and how best to put them into practice. We know that sustainable environmental change doesn't happen on a linear timeline with a clear start and finish, which is why we encourage our partnered sites to follow these steps every year. First, they assess and develop a plan using our Let's Go self-assessment tool, which we've incorporated many of the HEPA standards. It helps them identify strengths and opportunities of growth, where they might want to make change and develop a plan for the year. Then they promote the healthy messaging of the 5210 and other educational tools that we have. They take action, put their plan into action, and then sustain those efforts through reviewing their current policies and aligning them with best practices to support healthy eating and physical activity. And then last but not least, we encourage every achievement, whether it's big or small, that we celebrate it with them, for them, and have them promote their great work within social media. Now I'm going to hand it over to one of our partnered sites, Aimee Moody, who's been with us for many years, and she's going to talk more about what this looks like in action.
Awesome. Thank you, Ashley. So I'm Aimee Moody. I am a 21st Century Community Learning Center program director. And if you can sound off in the comments, if you also are a 21st Century site and where you're located, that would be great. And so I work for LearningWorks. It's a educational nonprofit located in Southern Maine. We have 11 sites serving nearly 500 youth with around 76 staff members since July of this year. Like many out of school time programs, we are finally back in person, and we're almost starting from scratch since the pandemic. So goal setting has been very important at this time. A part of 21st Century goals, one of the main goals is health and wellness, and to increase the opportunities to youth during out of school time. So that's after school, before school, and during the summer through nutrition and physical activity. Like Ashley said, we've been in partnership for 7 or more years. And what that looks like is that we have a local representative from Let's Go. That local rep reaches out to me throughout the school year, and we touch base. She asked me what's going on, what's going well in your program with health and wellness. She calls or texts, emails, does site visits. And then once she has a little bit of feedback, she gives me resources. I complete an assessment, very user friendly. It took 10 minutes or less. In an ideal setting, you would sit with your staff and fill it out together to get a real unbiased opinion of where your program is at, and then set your annual goals. And all of the annual goals is aligning to 21st century, which for the state of Maine, we already are doing program quality goal setting. So it's very much in line. The Let's Go assessment does have HEPA standards in it. Next slide. Thanks. So the goals, after reviewing our program, this was really like in a quote unquote post-pandemic world. We really wanted to look at our after school program and get a pulse of like where we were at. And we saw that we needed to increase opportunities for physical activity. I feel like that's always a goal. Increasing outside learning opportunities. There were many times where being outside was the safest space for us. We're located in Maine, so we really had to get creative year round. And then increase access to healthy foods. I saw that food insecurity was really a popular concern at the beginning of this webinar, and my community is right in there. And so we designed our goals to address these 3 goals. And so the way that we were thinking out of the box to increase physical activity and outdoor learning was to create a 5th grade legacy trail. And so this is where we did the assessing, we designed our goals, and now we're putting it into action. We saw the need and we're problem solving. And so this was a student-led activity. They wanted a way to put their mark on the school in a positive, productive way. The after school program and the school day, this was a school day linkage with the out of school time program, which made it really sweet and effective. And we were in the out of school time program, we're a STEM-based program. So we were able to integrate a lot of, well, what's the distance, nature education, as well as obviously a lot of physical activity of like marking the trails and clearing some land. Next slide. These are a few more pictures. Students were using the engineering design process, which for anyone that's doing STEM programming, it really aligns with it. And it's reinforcing STEM concepts in a real world setting, which is pretty awesome. Next. With this comes challenges, but also opportunities. Challenges included limited funding. We don't have the trailhead that we want to have yet. And there's a lot of cooks in the kitchen. So there's a lot of different ideas about how students want to utilize this legacy trail, and then the community, the school community, the out of school time community. So just making sure all voices are being heard. There's so many opportunities though. We'd love to add a story walk sometime, which this would be a great way to partner with Let's Go as they rent out a story walk. And a story walk, for those of you that don't know, there's permanent structured ones that are like wooden stations that you can set up along a walking trail or along a playground, and you can update story pages. So it's literacy and physical activity embedded. There's also like makeshift ones that are less permanent, but more financially possible. We'd like to embed some more nature education or history into the trail, or potentially an annual trail walk or fundraiser. Another one of our goals was to increase access to healthy food. During the pandemic, we realized that so many families were going without, and they were really accessing food services. They were showing up to the schools during the pandemic. They were, going to the bus stops is what we had. When kids weren't coming to school, food was still being able to get out in some capacity. When students returned, we realized that they're getting breakfast and lunch, but then what? So that's when the out of school time program decided, okay, we're doing healthy cooking anyways as a part of our 21st century goal. How can we make this more beneficial to our youth and family? So we decided, instead of going to the grocery store, we're going to partner with a local farm, and we're going to purchase community supported agriculture shares with them. And so we would have designated amounts of fresh produce for 20 weeks. And it costs a little bit more than shopping at the grocery store, but it feels so good. And it's created another partnership that's long lasting. And I don't know about you, but like through the pandemic, I ordered so much from Amazon, and I had a very guilty conscience, and it felt so good to support someone right down the street. And what a difference for the kids when we returned to in person and they were able to know where their food is coming from. The science and nutrition education just like exploded. And now we've been doing this for 2 years. It's now built into our annual budget. So it's a budget line. It's a non-negotiable of we need to provide nutrition education. We need to provide STEM activities, and this is how we're going to do it. This is a few ways that we implemented, and we did taste tests. So we did not have access to a kitchen. So we had to think smart. And so we did a lot of salads. We did a taste test of lettuce, spinach, arugula. Like so many kids had never even had that. We created veggie monsters. And yep, next page. Next slide. Veggie monsters. And this was a really low stake way for students to try new vegetables without being put on the spot. A taste test can be a little more on the spot, but designing their own veggie monsters, they were able to use the engineering design process, which reinforced all of our STEM activity, STEM curriculum. And then they were able to pick out the foods that they wanted, and they could try it afterwards. Obviously, a lot of hand washing too went on, but it was really awesome that they were able to try new foods. Obviously, there were some challenges. We didn't have cooking space. It didn't work out for us this year. So that's something that is also an opportunity. It's an opportunity to write a grant or connect with maybe a local church or organization that does have access to a kitchen. We're currently operating it in-house with after-school staff facilitating the nutrition education, which it's done well for 2 years. When we do it again next year, I would love to partner with a local community college or state college and have nutrition interns come in and implement some higher quality education, partner with Maine SNAP Ed, and identifying other curriculums like Cooking Matters. Of course, we also food brings in a lot of families, as we know. So family engagement, that's a really good carrot to wheel them in. And so that is another way that could do this. And so my final comments are, as you can see, we've collaborated with our partners at Let's Go, utilizing their assessment tools that follows the HEPA standards to create program quality goals that are goals that we already were doing for 21st century, which is really awesome because it can be very overwhelming. I'm excited to continue conversations and learn from others and hear what other people are up to.
Awesome. Thank you, Aimee. So great to see the pictures and these activities like come to life. So, and to really see this work happening in your program. So thanks, Ashley and Aimee, and to all the presenters. We are going to cruise along because we are getting close on time and want to make sure we have breakouts. So there was one question for you, Aimee, in the chat box around whether or not you all have a curriculum. So if you wouldn't mind responding to that in the chat, that would be great. And if other people have questions, please put those in the chat. We're going to be tracking those. We have a TA workshop coming up in December. We can continue the conversation. And we can also get responses from our presenters. If we don't have time to get their responses to your questions today, we'll be sure to facilitate that. So Anna, if you want to go through a few slides, I'm going to turn it over to Claire Grace. We can skip this one. Our presenters kind of talked about all that. Claire Grace, if you want to introduce the breakouts.
It would help if I was unmuted. Absolutely. So we have heard all these amazing things that are happening in other places. And now we would love to have an opportunity for all of you to share with each other. And so for our breakouts, we're going to be using Padlet, which I had actually never used before either, but I love it now that I have been introduced to it. And so we're going to put the link in the chat, or you can also use the QR code to access it from your phone. We're going to put everyone in breakouts of about 8, and you will have 8 minutes in your breakout group. And we'd love if you would choose a note taker within your group. Once you all get in quick introductions, choose a note taker. And then you'll see when you open that link to the Padlet that there's a couple of different sections. I'm going to show you the questions next, but really we just want an opportunity for all of you to talk about what you're currently doing that's working well, areas that you see as opportunities for improvement, and the resources that you use. And if you want to go back one slide just for a minute, I just want to show folks what we'll do is have the note takers. It's super easy for each kind of new idea or something that someone shares for each of those sections. You just click that little plus button and it makes like a little post-it kind of thing. You can put whatever the sort of main idea is, put a little description. And then when we do the debrief at the end of the breakouts, what I love about this in particular is we'll give everybody a few minutes then to actually go back into the Padlet, and you'll be able to read each things that each group has posted, and you can comment on them, or you can click the little like button. And it's just kind of a nice way to interact with the information. And then we'll have a couple of minutes to talk together about the debrief. And so, and actually looking at the time, I'm going to say, we're going to put folks in their breakout rooms, and we're going to actually do those for 7 minutes. So you'll have 7 minutes to share. And again, the questions, and these will be on the Padlet, so you'll see them, is what are you currently doing to advance health equity that's working well? Where do you see areas for improvement, and what resources do you use? So, and the link is there in the chat, and we're going to go ahead and put everyone in their breakouts. All right, well, welcome back, everyone. I hope that you had an opportunity to have some good conversation in your breakouts. The link to the Padlet is in the chat, and I'm going to give everybody just maybe like 2 minutes to, if you haven't already, if you want to navigate to that link, to give everybody a chance to read through what other groups shared. And as I mentioned, when we were setting this up, you'll see there's this little heart button here if you want to like something that someone else posted. You can also click right here to add a comment. And so I'm going to give everybody like just 2 minutes so you feel like you can start to sort of take in some of these amazing ideas that were shared by your colleagues. I see lots of likes, some likes getting added. Looks like people are working their way through. Couple things added on the challenges. Let people get a minute to get over to resources too. Awesome. Well, feel free while I'm just going to do a kind of a short look through and kind of bring up to the front a few things that were captured, but please feel free while I'm doing that to stay on your Padlet screen if you want to go ahead and keep adding some likes or some comments to what other people have shared. As far as successes, there's a couple different successes around using offsets from marijuana taxes. Some ideas around expanding access to after school, taste test activities, ordering from Instacart, Let's Go, partnering with SNAP. And they mentioned that briefly as an upcoming opportunity that they were looking at during their presentation. Having cooking lessons. And then we've got some things over here as far as the challenges. Some of which we already heard, limited space for after school. Feel free also if you see that someone has shared a challenge and you've found a way to work around that. I know in our presentation for that one example, for example, they talked about potentially partnering with churches or other organizations that might provide access to their kitchen. So feel free to add in the comment if you've experienced a similar challenge or you found some way to work around it. Crowdsourcing and sharing the wisdom of this group is, where it's at and where we're going to get the best ideas from. Other challenges around lack of access to readily available produce, having enough funding to supply it. And so again, if folks have thoughts about how they've addressed those particular challenges, feel free to use that Padlet link. All you have to do is just click right here where it says comment, and you can type in and add your own thoughts to these. And then some ideas shared under resources as far as working with 4-8 extension, partnering with outside organizations, cooking matters, working with cafeteria providers and schools. And then the You're Not Alone, the NAA affiliates and statewide after school networks. If you contact your affiliate or that's associated with the area that you're in and asking them for, they have technical assistance and professional development and advocacy support. So lots of options there. And then just also wanted to say, we thought this was a great opportunity to just start pulling all of these ideas and thoughts together, and that we can use some of this to build on the technical assistance call that will be available next month, that I am now going to hand it over to Kate to tell you all about what's next.
Great. This is great. I love Padlet. I love these ideas. Thanks everyone for sharing. We will be sending this out as a follow-up. And so Anna, if you could just pull up the commit to action slide. Excellent. Thank you. So again, this is a series. So what can you do to commit to action? Well, you've done one thing. You've attended today's virtual institute. So thank you for your participation and actively participating. Some next steps you can do is download those HEPA standards that we were talking about, and the self-assessment. You can complete the self-assessment. You can either do a paper copy, which we'll send the link to, and then there's an online version on the Alliance for Healthier Generations Action Center. So you'll get links to those. And then we encourage you to join us on December 13th for the technical assistance workshop. We'll bring the Padlet back to that technical workshop. You can bring your self-assessment results back to that workshop and really connect with your peers to dive in more and have more discussion. And then our next 90-minute virtual training session will be on January 24th. So you have all the invites and all the information for that, and we will be following up and making sure you have information, have access to all this information, and can fully participate in the upcoming events. So the very important thing, Liz is posting links to the tools that we're talking about. I am going to post a feedback survey. So we would love your feedback on how today's institute went and what interests you have moving forward. So as I've mentioned at the top of the hour, this is a new project, this is a new partnership with EDC and the National After School Association. And we will be continuing to support this work in advancing health equity and out of school time, and your feedback on your needs, your areas of interest, and also just how today's session went so that we can improve our next upcoming workshop and our next training session. So your feedback is really, really important to us. So please take this last minute here, click on that link. So the January 24th training is going to be a continuation of today's training. So in that training, we're going to talk more about developing a continuous improvement plan, spending some time on an action plan, and kind of unpacking the kind of how to implement practices to make change. So it's not a repeat, it's a continuation. Good question. All right, so thank you all so much. Anna, can you go to the next slide very briefly? Again, if you can take the last minute here and click on the feedback survey link and tell us your feedback, that's great. You'll get the slides, you'll get the recording, you'll get all the links to resources shared. And so this is all be coming at you via email. But I just really want to thank you all. I cannot thank our presenters enough. Thank you for sharing your wisdom from your experience and your expertise and your challenges, for being open and honest. It's so helpful to hear from you all. And thanks to the whole team for making this institute happen. So thanks to you all. Please take a minute, do that feedback survey, reach out to us if you have any questions, and we will be in touch with you very soon. So thank you. With that, I think we can go ahead and close out the room, and I hope to see everyone in December. Thank you.